What is good? It is your boy Pablo Gray, and we are back with another reaction video. And today we have a clip from CBS This Morning. Title of the clip is "Researchers Sound Alarm on Severe Cases of COVID-19 in Children and Teens." I don't really know how I feel about CBS, man. Sometimes I feel like they just you know what? Yeah, I just feel like they just be trying to get a story. I don't think they got a preference on who the fuck they really aim at, but I just think they try to get a story, whether it's true or not. But yeah. Before we get into the video, if you like what I'm doing here, press the subscribe button, like, comment, share it. I really do appreciate it. Thank you. Let's get into it.
National Institutes of Health is launching a study to learn more about how the coronavirus affects children. While most kids have milder symptoms than adults, not all do. Our senior medical correspondent, Dr. Tara Narula, now reports on what doctors hope to learn in the study.
I would never picture me having to be intubated and being in the hospital.
16-year-old Carla Duarte is a coronavirus survivor. The high school junior from New York is one of the relatively few children in the U.S. to have severe complications from COVID-19.
Her numbers were not improving. Her oxygen level was not improving.
Doctors told Carla's mom, Anna,
Y'all can say whatever y'all want, judge me how you want, but my question is, did she survive? Did she survive?
they had one treatment option left, an ECMO machine, which pumps and oxygenates the patient's blood outside the body.
When they told me about the machine, they said, this is 50-50.
After 7 days on ECMO and 5 more on a ventilator, Carla's condition finally improved. She was sent home after 21 days in the hospital.
You never had any medical problems before this? No.
Serious cases like Carla's are rare, complicating the efforts of investigating.
I am glad she did survive. I want to know if someone's going to do some research on how her health was post-ventilator, while she had the ventilator, and pre-ventilator. I would like to know how her health conditions was. To see, at least do a study on that, because I think that information would be very important on trying to analyze how severe her symptoms were and why they became so severe. Yeah, that's just my opinion though. My suggestions.
We have much less experience because the children are just getting less sick, so there are many fewer children interacting with the healthcare system and being tested.
Dr. Tina Hartert of Vanderbilt School of Medicine is leading a new NIH study remotely monitoring about 2,000 children and their families in 11 cities nationwide. She says that more data should be collected before a decision is made to send kids back to summer camp or school.
I think it's really risky to base decisions about this based on the fact that children get less sick from this virus, because that does not equal children being less likely to transmit the virus.
We're not.
So, regardless, with all of this being the case, even with the numbers suggesting that this is less infectious as the flu, less deadlier than the flu, why are we taking these precautions now? Just think about it. From now on, it doesn't even matter. Your kid get the common cold. Because the common cold has similar symptoms as coronavirus, your kid is now quarantined for the next 14 days until they figure out if or if not he's positive or she's positive. This is the state that they want people to be in, and I want shit to go back to normal. I'm telling you, first build up your immune system and your entire family. Then allow your family members and children and everyone, bro, to interact with each other and allow them to come face to face with this virus, so that their body can develop antibodies to now fight it off in the future. And the antibodies, they will change as the virus mutates in the future, so that the human race will have no problem when in encountering this virus in the future, even as newborns. That's how the human body works. But back to the video.
Completely sure what are the risk factors for why these children get sick with COVID? Dr. Adrian Randolph is leading a separate CDC-funded study at Boston Children's Hospital.
A CDC-funded study. So don't be surprised if you're about to hear exactly what the CDC wants you to hear. And what that is that it's very dangerous. You should wait a long time before interacting with people, or wait till you get vaccinated before you go around people. Let's find out.
What are some of the interesting or different presentations that you've seen in children with COVID-19? It's scattered reports. What they're seeing is cardiac dysfunction, so that their heart's not working as well as it should, and abdominal pain is often part of the presentation. 12-year-old Juliet Daly went into cardiac arrest after arriving at a New Orleans emergency room.
They had to do 2 minutes of CPR on her. And then they got her back, thank God.
Her mom says she tested positive for the coronavirus and another viral infection. She was in the ICU for 10 days before recovering.
What message would you want to give other families regarding children and the risk of COVID?
Be vigilant, be careful. It can become very severe in less than a day.
The New York City Department of Health says there are 15 children in the hospital with a very rare inflammatory syndrome that they're saying is potentially associated with the coronavirus. It can involve fever, rash, low blood pressure, and inflammation of the blood vessels, including the coronary arteries.
Oh boy, Tara. So one of the more fortunate aspects of this outbreak is that although we have seen some severe cases, children generally have more mild symptoms. Do we know why?
It's really fascinating, Tony, and the experts say we don't. There are a couple of theories. One has to do with the fact that children may have less of those ACE receptors, or less functional ACE receptors. These are the receptors in the lungs that the virus attaches to and gets into the cells. That may be why they don't get sick. Another theory has to do with the fact that children are exposed all the time to lots of other coronaviruses, the ones that cause the common cold, so they may be developing antibodies.
What did I just say? What did I just say? I'll wind it back so you can hear it again.
Why they don't get sick. Another theory has to do with the fact that children are exposed all the time to lots of other coronaviruses, the ones that cause the common cold, so they may be developing antibodies to those that are cross-reactive to COVID-19 and therefore helping them. And the last has to do with the fact that their immune system may be primed just right so they don't have that overwhelming cytokine storm and hyper-reactive response that's causing a lot of adults to get into trouble with COVID-19. But really, lots of questions remain.
Basically, what she's just saying is that they're young, their immune system is quite new, and it's been strengthening. Unlike adults who've had this immune system for years that peaked at one time, was good, started eating shitty because they're adults and they're working all the time and they don't really have time to eat healthy, and they don't necessarily have the money to eat healthy, so their immune system is fucked, and then they get old and now their immune system is terrible. She's right. The kids, their immune system is at peak condition right now. It's young. It's been strengthening over the years, and it's been exposed to thousands of different fucking viruses and germs. That shit got level 100 armor. Straight the fuck up. And the only reason they wouldn't is if your kid's not necessarily the healthiest kid in the world. I've been saying this shit. She just confirmed it. Thanks.
Very interesting. And of course, we've had questions about the school year now, also questions about summer camp. That's a big one in my household. Tara, thank you very much.
Okay. Let me make sure it's not about to load, but I guess my final thoughts on this is basically just confirmed everything I was already saying. If your immune system is up to tip top shape,
Own a business? You're gonna want to hear this.
Up to tip top shape, and you around motherfuckers who happen to have viruses, you gonna develop antibodies to fight them off, so you're not as sick. Make sure immune system is good first. That's simple. Been saying it. I don't think I got anything else to say. You're welcome.